Right, so as Faith said, I'm the lead physiotherapist here at Leeds at the LGI, and I've actually been doing this job. I've been a paediatric physiotherapist 10 years now, which sounds a bit scary to me, because that makes me feel older and older and older. And I've actually been doing oncology and haematology for 4 years. And I think the activity is something that when I first started, I didn't realise that that was going to be as much of a part of a role as what I thought it was going to be. And actually, when I first started, I realised that there was lots of evidence out there to say that children that have had a haematological or oncological diagnosis actually aren't as physically fit into their young adulthood as their normal peers. But thank goodness that this is actually changing, and this was evidence in kind of the 90s, but more recently this is changing. So today, what I want to cover over the next 20 minutes is really what happened to our patients or our children's exercise levels during treatment. Why did that happen? What benefits during treatment of exercise there is? What benefits of exercise after treatment? How to help you to change and motivate your child or yourselves as a family, how to incorporate those into everyday activities, and also things that you can use in your toolkit for signposting, so signposting you and families and your children towards different areas. So these are a lot of comments that people have said to me. This is what happened during treatment. What some of the children would say is they didn't want to play, they had a line in their arm, they had a line in their leg, they didn't want to move, and they were scared. They weren't allowed to go swimming, and that was something they really loved. They couldn't go every week. And actually, quite often, it's the doctors. But my lovely friend Bob here is very pro-swimming, and we're trying to change that to try to help them to get a little bit more active. They were told to stop playing football. They were always very, very tired. It was easier to be pushed in a wheelchair than actually to make them to get them to walk anywhere. A lot of them were quite anxious about bumping or catching the paw or the Hickman line. They were too tired or just didn't feel like going to school because they'd not been in school for quite a while. And actually, one of the biggest things it said is that my parents wouldn't let me do that because of parental anxieties, which is quite normal and quite natural, and that's kind of why I'm here to talk today, and that's why one of my main aims on the ward and as a physiotherapist is to try to take away those anxieties around exercise. No? Gone too far. So I think this kind of just sums up the previous slide, is that what happened was that the medical staff, really, us as medical staff, we stopped them going to nursery, we stopped them going to their extracurricular groups, we isolate them because they've got infection, they're constantly attached to a drip stand, not allowed to go swimming, too tired to walk, they've got central and peripheral lines, not allowed to play sports, and they're wanting to be carried and going in a wheelchair. And all these things stop them maintaining their normal level of activity during treatment. So I kind of see it as being a little bit of a vicious cycle, really. We have some treatment side effects that stop them from maintaining their own activity levels. This then goes on to the fact that they then start getting increases in aches and pains, and back round then to decreased motivation, and that circle just keeps going back round and back round and back round unless we can pull them out of that circle. So what side effects affect their physical well-being? So we know that there's 3 kind of main different types of treatment. I apologise if it's not very good at the back, but there's the chemotherapy, the radiotherapy, and some children have to go through significant surgery that can give them what we call physical side effects that will affect them. And there's a long, long, long list of these physical side effects. And it's kind of, some children will have one, some children won't have the other. It's that uncertainty, a little bit like Bob. We don't know at the beginning of the treatment which child will have one and which child will have the other. But what we can all try to do as professionals and family members is to try to use exercise to try to make sure that we're getting rid of all these side effects, or we're maintaining them and trying to promote better health. I think one of the main side effects that people don't really realise is around the delayed growth, really. Children, as normal part of their activities of daily living, are active, and that actually helps their bone growth, it helps their muscle development, and it also helps them grow and be biomechanically correct. And what I find, a lot of the children that are coming to myself are complaining of aches and pains afterwards because they've not had that opportunity to maintain their muscle bulk, to maintain their biomechanics. That also means that a lot of them become flat-footed. They may start changing their walking pattern, but if we can try to prevent this by increasing their exercise and activity right from the start, then hopefully we can take away some of these problems, or at least help with some of these problems. So we can prevent and we can improve these side effects. And over the past 10 years, there's been more and more research done, mainly in adults, unfortunately, but starting in the past couple of years to be more in paediatrics, that exercise does significantly change all those things on the previous slide. So during treatment, this is one of my beautiful patients who was very, very debilitated at the start. And she actually was probably somebody that now is more active than anybody. And as you can see, she's being active and she's doing things while still attached to a drip stand. So we know that during treatment, well, this is a bit of a dodgy one, and I'll explain the reasons. The first one is that it can help clear chemotherapy. So I've been telling a lot of my bone tumour patients that when they're on methotrexate, they have to wait 4 days to help clear that 4, 5, 6 days to help clear the methotrexate from their blood. And more recently, they've started to listen to me that if they get up and they start walking and they're more active, they've actually twigged that the methotrexate clears quicker out of the blood and they can get home sooner. I don't think that's evidenced, but there have been a few of my patients that have actually started doing it more recently, and they say to me, "Do you know, Liz, it really works. I got home in 3 days this last time. Last time I was 5 days, 6 days." So there must be some method behind it, really. We know, and Bob's now thinking, "Oh, there's a study in there somewhere." We know that there is evidence as well that it does help to stimulate bone marrow, mainly lymphocytes and granulocytes, really. And as much as that may not make a difference, it may just improve that neutrophil count that you're waiting for before you can go home. Just those tiny little differences can make a kind of huge effect. It can keep the chest clear. Yep, most of the children are immunocompromised, and they are that little bit more at risk of chest infections. We know that exercise does improve psychological well-being. It improves mood. It improves that feeling that they can do, and they can be positive, and they can be independent as well. It maintains bone density during treatment. It can also help to maintain a healthy weight, although Evelyn, from a dietetic point of view, sometimes we're saying, stop them exercising, don't let them burn any more calories, we need to keep those calories in them. But actually, by exercising, it can induce kind of an increased appetite as well, because they need more calories. It has evidence that decreases pain, movement reduces constipation, and it also plays a big part in managing fatigue. So that's all the things that are during treatment. And is it safe? Well, it depends. You're not going to send your child out with platelets of 20, playing football, rugby, being tackled. It's all about adapting the exercise to the child. And we've got to adapt on the ward. The exercise and activities that we do have got to be adapted to that child, because they are stood next to a drip stand or they are isolated in a side room. But I think the main thing is, rather than seeing exercise as something that's hard, I think we should kind of start to call it activity, because it's not necessarily exercise. All we're wanting our children to be is active and adapting to their condition. So what about after? after treatment. Again, they're all very, very similar, but it does increase bone density, and there's a lot of evidence regarding that. And actually, children, your bone density increases all the way up to the age of about 25, 30. So if you think about these periods of our life where we've made them inactive, what are we doing to that bone density there? And what we need to do is to try to build up that missing bit, that missing chunk of time. It also... I've got increases bone density twice for some reason. That's how important it is. It also can help improve lung function. Lung function of our children, as much as we don't test it a lot, it will be decreased. And we know that by exercising, we can increase their lung function. It maintains and also reduces weight. A lot of the children that have come off the leukemia treatment do suffer with weight issues. But we know that that's another kind of side effect, another complication that we don't want them to have, and the exercise can help to reduce the weight. It has a massive boost from a psychological point of view as well. There is evidence out there, not in paediatric cancers, but mainly in breast cancer, and I think bowel as well now, that it can help. Exercise has been proven to help reduce the risk of reoccurrence. And I think that's probably one of those uncertainties again, and it's something that you think, actually, just if I can do that little bit to help my child, then you never know. We don't know what evidence is going to come out in the future, but it is definite significant evidence in breast cancer now at the moment. And it massively reduces the risk of secondary problems. So let's put this one on. So actually, what should we be doing? What's the national guideline of what everybody should be doing? So I'll start off with the easy one. So those that are under 5, when we think about exercise, we don't really think about under 5s exercising, but it is still important that they are active. So for those that you can't see that, is that physical activity should be encouraged from birth, particularly through floor-based, play and water-based activities in a safe environment. So for those that are under 5 and walking and mobile, how much exercise do you think the Department of Health actually advises us to do with those children? Anybody want to hazard a guess? I think it'll probably more than you actually realise. So for an under 5-year-old who is active, they should be doing physical activity for at least 180 minutes, so that's 3 hours, spread throughout the day. And I think that's where it's important to say that it's not exercise, it's activity. And when you think about an under 5, they are active for that 180 minutes. But some of our patients, some of our children probably weren't during their treatment. They weren't that active. So what about the 5, 6 to 18-year-olds? How much do you think we should be encouraging them to do? 5 hours a day? I don't think we'll manage that, but it goes down actually. So the younger you are, the less exercise the Department of Health are actually advising you. So they're saying, but it's a bit different because for the under 5s, it would just be general physical activity. But for the children and young people, 5 to 18, they're saying a moderate to vigorous, intense physical activity for at least 60 minutes a day, if not more. And hopefully that should be happening at school. But it's not always. If it's your child, they may be standing in the playground and not running around, not playing. It also depends from a child point of view. And what about us as adults? And then we'll have a show of hands to see who actually is doing that amount of exercise. So for adults, 19 to 64 years, it's over a week really, that it should add up to at least 2.5 hours of moderate intensity activity in bouts of 10 minutes or more. So who do you think, who kind of honestly here probably does that amount of exercise? It depends, doesn't it? Because if you're doing 10 minutes, as long as it's more than 10 minutes, it might be a 20-minute brisk walk to work in the morning. Something's as simple as that. It doesn't have to be exercise. It doesn't have to be going to the gym. But I suppose what's important to think about is when we compare this to the children that have come through our care, we know that that's probably not happening. And is it realistic? Can we get them doing that as much? Probably not, but we can try. And I think that's the important thing. Because nobody likes change. And if I said to you, before your child was ill, how much activity did they do, compared to now once they're coming through the treatment, is it the same? Or are you finding it harder work now than it was before, trying to maintain them and motivate them to be active? And hopefully today, I've just given you a little bit of thinking about why it is so important. I think some people might be in this pre-contemplation change, that they don't really know why it is important to change, to try to become more physically active. Hopefully, you'll all be starting to contemplate it now, and then hopefully we'll be able to push you through into maintaining a healthy and active lifestyle. This slide just goes to prove that, really, it doesn't take much. For instance, obviously, she's only going to walk around the kitchen. But it only means is that rather than getting in the car to go to the local shop, walk there. Rather than getting in the car to go and pick the kids up from school, just give you a little bit of extra time and walk, or go to the park on the way home. All those little things in your everyday life can be changed and tweaked. But then it does get difficult because, these all come up separately. Because a lot of our children haven't got that amount of motivation, so they're going to need a help. They're going to need a helping hand. For some of the younger ones, it'll be you that would be kind of saying, right, we need to change our life. We need to do some goal setting and we need to change. What do we want to change? And I think there's some lovely kind of paperwork. You know, like when you get on your fridge, when you're wanting to lose weight, you always say to put a fat photo on the fridge, don't they? Well, sometimes when you've got a visible piece of paperwork in front of you that's saying what your family's goal or what your child's goal is, whether that's to be able to walk to the end of the street without being breathless, whether that's to be able to climb a climbing frame, you've got to break it down and think about it. And when a child can see that in front of them and how they're going to reach that and how they're going to get that goal, then it does help, and it helps as a family as well. And this is just one kind of, this is a SMART goal, so it's just one kind of piece of resource that is out there on the internet that you can actively get, pop it up on the wall somewhere and sit down as a family and kind of work out what your exercise goals, activity goals are. The other things that are out there are Move It minutes. And this might be that it's a bit of a rewards chart for some of the younger ones. Cut them all out. Or stick her over your 15 Move It minutes. If your child's being active, there's that reward at the end of the week, whether that's a trip somewhere, a trip to the park, anything like that. But we've got to disguise exercise. We can't call it exercise to an 8, 9-year-old that really doesn't want to do anything, doesn't want to go out. We've got to disguise it in some way, shape or form. And it's kind of like tricking them into doing things, and that's why I'd say the best word is called activity rather than exercise. Some of the resources that I use quite a lot is quite a few of the charities, and this charity has been really useful, and everybody that's applied to this charity have actually managed to get a bike, whether that's an adapted bike or just a bike that's a bog standard normal bike, because most of the kids have grown out of their bike, and that's something that they can see during the treatment, after the treatment, that they can use, and they can see that actually I got that bike because I've been through treatment, and that's a little bit of a special thing to them. The other really useful resource at the moment is the Change for Life resources, and actually I'm using these quite a little bit with the kids on the ward. You can send off for a free pack, and you get lots of activity cards and a stopwatch. That mine's actually broken because I think it was only cheap. But it gives you lots of different ideas of activities to do as a family, and they're actually all Disney themed. You get a beautiful sticker chart that gives you different weeks that you can put your stickers on. And they're really nice activities. For instance, it's Lightning McQueen's Raceway. Can you help the racing rookie Hot Rod win the Piston Cup? So you've got to make yourself a piece of paper, you've got to draw a car on it and then cut it out. and then you've got to mark a course across your living room, get on your hands and knees, and you and your child or the children in your family to blow that piece of paper, to blow that car across the living room. All those little ideas, sometimes that's all you need, is just ideas and things to do with them to help them to be distracted. The other, for this area, and obviously I think there'll be very, very similar opportunities in different regions, is West Yorkshire Sport. They do have a really good wide variety of clubs for catering for children that have actually got more physical disabilities after their treatment, or catering for children that are just a little bit more tired, a little bit more fatigued, and just need a bit more of a helping hand. But there's lots of things going on. It's just trying to find them and trying to get that into your everyday, regular routine. And that is it. Thank you. Oh, and also that brochure, which is the Children's Cancer Leukemia one, with the sport and exercise, is very, very nice as well.